It is the About Mansfield Economic Spotlight. We are sponsored by the Mansfield Economic Development Corporation. What do we do here? We feature people and their companies that have made an impact on Mansfield. And one of those people and his company is right over here to my left. Say hello to Kenneth Rose. He's the president and CEO of Texas Health Hospital. Welcome to the Economic Spotlight.
Howdy. Thank you. Excited to be here.
Tell me about the hospital in Mansfield. It's not real old. It opened, what, in 2019?
2020.
2020.
December 1st, 2020.
Why did Texas Health decide to build a hospital in Mansfield?
Aside from the exceptional podcast in Mansfield, we have, as Texas Health, done a lot of research about the whole DFW Metroplex. You know, they estimate about 1,000 people a day moving to DFW, which means healthcare is growing.
Right.
So a lot of research has been done over the north, central, and south sections of DFW. And for a number of years, since about 2015, THR and our partner Advent Health have been focused on this Mansfield market. We know that the north is saturated. We opened a hospital in Frisco about 12 months to the day before we opened in Mansfield. And we really knew that those two markets were hotbeds for growth. So through research of population growth and trends and traffic, we realized Mansfield was a hot spot where we really needed to get in front of some of that growth.
Yeah. You were you were the president before you opened then.
Right. Yeah, I started working on this project in 2017, 18.
And so you were right in the thick of COVID. And that's got to be tough. How has your leadership, because you got to be the fearless leader during whether it's crisis or nothing going on. How has your leadership style changed, or has it changed during COVID versus now?
It has.
It has changed.
And the interesting thing is this was my first CEO job.
Yeah.
I had been on an executive team for a few years before that, but it's a little bit different when the buck sort of stops with you.
Yeah.
And when you're doing it through a global pandemic that no one has really led through before in healthcare, you learn a lot very quickly.
Was it a case of all of our beds are full, our hallways are starting to be filled, and people are looking at you for what's our leader going to do? Or
Yeah, exactly. And I'll share a story. I've told this story around Mansfield a few times.
Sure.
But I was rounding in the hospital one day as we were
rounding in the hospital, making the rounds?
Making the rounds.
Okay.
Talking to the team, asking how I can help, seeing how people are doing, try to do that regularly. I was doing that. We were, hot and heavy in COVID. You're right. We didn't have enough people. We didn't have enough beds. People were stressed. People were floated around the hospital to work in different areas. I'm walking down a long hallway in the back of our hospital, and I come around a corner, and I see one of our nurses coming around the other corner, and we're walking towards each other. And it was one of those moments where you knew a conversation was coming, right?
Oh, yeah.
You could kind of tell. And so you're holding your breath as you walk is this going to be a good conversation or one of those other conversations? And so sure enough, I get closer to her. She starts taking off the masks that she's wearing. And she just started to unload her emotions on me about the stress of this situation.
Oh.
We can't keep doing this. I don't even work in the ICU. I've been floated to the ICU to help. They're overwhelmed. I'm immunocompromised. Just everything that she was feeling. And all I tried to do in that moment was listen and hear her out and what she was going through. And she kind of finished and paused and said, "What are you going to do about this?" And I just told her, I'm sorry. I know that this is hard on you guys on the front lines. I don't have a lot that I can do for you right in this moment, but we're trying to do everything we can to make sure you've got the equipment you need, the support you need, the people you need. And so in talking through that, we got to the end of the conversation. It was interesting because she sort of took a sigh and said, "Well, I'm not going to leave them alone up there.
Oh, awesome.
Our team can't do this. They need help. I'm not going to leave them alone." And that was such an interesting moment in my leadership, especially as a CEO, because it gave me a glimpse into one of the positive things that happened in this pandemic was in healthcare, our teams probably were bonded even a little bit tighter than we historically were. Because when your team needs you and you jump in and help, that's a great way to grow together.
And it's not a situation where you hear a story like that and you can't give her a hug. Nobody's touching each other.
That's true, yeah.
And that's for me. I'm a huggy kind of guy, and I you know what? I feel for you. I empathize for you. I've been there. Can I at least start you off with a hug?
Yeah.
But 6 feet.
Yeah.
How about one? All right. What's been one of the most particularly proud things that you've done at Texas Health Hospital?
That's a great question. I would say there are a lot.
Yeah.
I'll give you one, which is our Leapfrog Grade A that we received the first time we were eligible. So Leapfrog is an independent third-party organization that evaluates healthcare hospitals and companies across the country. They take the data for the patients that you've seen and the work that you've done. Mm-hmm. They have criteria on patient experience and clinical quality and availability metrics, and they give you a grade, a very honest grade.
Yeah.
And what I'm proud to say is that Texas Health Hospital Mansfield not only achieved an A our first time out, but the team achieved a very high A, something like kind of like 98 out of 100 type of an A. And we maintained that not only in the spring of 2023, but also in the fall, which we just received recently. So I'll tell you, Steve, Mansfield's blessed to have two good hospitals, Texas Health Hospital Mansfield and Methodist Mansfield. We need that. As we're growing, we need two high-quality hospitals because we shouldn't have to drive to Arlington or Dallas or Fort Worth. We're a big city here.
And let's talk about the growth in the city. That there is life beyond Broad Street as you're heading south on 287 or south on 360. And what are you looking forward to in the growth of the city?
I'm very proud of the growth I'm seeing just in the 4 years I've lived here.
Sure.
And all the ways we're developing. I am excited to see retail in the southern part of Mansfield. We have a beautiful neighborhood with South Point there on Lone Star Road. We have our hospital on Lone Star Road. But we are very excited to have people coming down to our side of the city for restaurants, for coffee shops, for stores, because that's how people will realize there's more to Mansfield than just north of Broad.
That's right.
A little bit south, too.
Right. Texas Health also has, aside from a hospital, I'm a patient of the Texas Health Family Resources, and I believe there's also a rehab center on Miller Drive or Miller Road. As far as
urgent care, too.
Okay, urgent
on
care.
Debbie Lane, 287.
Was unaware of that. My resource department will get on that. Texas Health, as far as the hospital goes, it is the southernmost hospital for Texas Health in North Texas, in the Metroplex.
Correct. On this side of the Metroplex.
Right. A lot of them up in North Texas.
Right.
And do you see Texas Health, as far as hospitals, expanding further south?
I don't know is the honest answer. We do see the south part of the Metroplex as an opportunity. I would say South Dallas, South Arlington are big opportunities for growth in the future. For now, we're trying to create an anchor with Texas Health Mansfield where we can help pull those patients from Waxahachie, Venus, Alvarado, Midlothian. They're going to be a good opportunity for us to grow here in Mansfield. And we're always open to opportunities because the growth is going to continue to be in the south. The Frisco, Plano, Alliance, those areas have exploded.
Right.
And so now people are starting to look south. And we want to be able to provide that healthcare for them close to home. High quality healthcare close to home.
In the few seconds that we have left, if someone wanted more information about Texas Health Hospital, where can they find that information?
Find us online. Google us, Texas Health Hospital Mansfield.
Yeah.
Or go directly to our website, texashealthmansfield.org.
texashealthmansfield.org.
That's it.
And there is life beyond Broad Street.
South of Broad, there's a whole new world. A whole new world.
Oh, stop.
Okay. Well,
That is the About Mansfield Economic Spotlight. Kenneth Rose, President, CEO of Texas Health Hospital, right down there, the southernmost exit here in Mansfield, down Lone Star Road. TexasHealthMansfield.org. And Kenneth Rose, thank you for being on the About Mansfield Economic Spotlight.
thank you for having me, Steve. I always love it.